Hi, everybody. Dr. Mark Beaty. I'm going to talk a little bit about otoplasty, which is a procedure to modify the shape or the prominence of the ears. Many people have ears that protrude a little farther from their head than they would like, or that have a shape that they don't find pleasing. And the most common reasons for this are failure of the antihelical fold, this fold right here, to fully form, excessive size of the contral bowl, which is this portion of the ear, or both. And those deformities can cause the ear shape to look a little bit funny. They can also cause the ear to protrude a little bit too far from the head. So the otoplasty operation accesses the ear cartilage by making an incision behind the ear. And once the cartilage is accessed, I'm then able to modify it by sometimes removing some cartilage, sometimes softening and reshaping some cartilage, sometimes using sutures to move the cartilage into a different position. Once the ear is reshaped, the incision is closed, and the procedure is basically done. This is a procedure with a relatively short recovery time. It often can be done in the office under local anesthetic, and other than needing to wear a protective dressing for the first couple of days, people are generally back to their normal activities inside of a week. So this can be a very effective way to improve the appearance of overly prominent ears or ears that have a shape that is not as pleasing as we would like it to be.